The number of people who have died after testing positive for COVID-19 in UK hospitals has risen now. That total stands at 9,875. Those figures that come to us from the Department of Health represent an increase of 917 on the number of victims that we reported yesterday. One of those in the latest set of numbers was only 11 years old. We've also heard from NHS England today. Now, they have reported another 823 people who have died with coronavirus. London has again more than any other region, 208 people there confirmed to have lost their lives. And in the Midlands, there were another 165 reported deaths. In Scotland, another 47 deaths have been recorded there. That takes the total in Scotland to 542. Public Health Wales, meanwhile, says 36 more deaths have been reported there. That takes the Welsh total to 351. And Northern Ireland's Public Health Agency says that another 15 people have died there, taking the total to 107. Now, Laura Bundock has more on all of this for us from the newsroom. Laura, as we approach a grim landmark of nearly 10,000 people to have died in UK hospitals, so the true total presumably much greater than that. It's a time to stop and reflect, isn't it, on the number of lives lost?
Yes, it certainly is. These are huge figures. Today's figure of 917 deaths in the UK is considerable, but it is slightly less than the same figure reported yesterday, which stood at 980. Now, there are lots of things to take into consideration when we look at these figures. This does not mean that we are reaching a peak necessarily, that the peak is passing, or we're even in the middle of a peak, purely because we know that we've had a bank holiday yesterday on Good Friday. What we've been seeing after a weekend, so the Monday figures following a Sunday, have always been slightly lower. So I think that certainly needs to be taken into consideration. And of course, you're right. What we're talking about here is the number of people who've tested positive and died while in hospital. And we know that the actual figure is likely to be much, much higher, because this does not take into account the number of people who are dying in the community. So this will include people who die within the care sector, in residential homes, in care homes, for example. If we look at the number of people getting the tests as well, that's interesting. So we know that 18,091 people were tested in the UK, and that is slightly lower than the previous day, and of course nowhere near that 100,000 goal that the Health Secretary has set for the end of the month. If we look particularly at the figures coming out of England, they are slightly down on the previous day, but saying things are down when we're talking about 823 deaths is a slightly strange way of putting it. We do know that they were aged between 11 years old and 102, and that 33 of them had no underlying health conditions. I think what we need to ask now is, what do these figures tell us? It's very hard to compare day-on-day figures. To look at overall trends is far more important, and perhaps we're still not far enough into the lockdown to get a bigger picture. But the one tiny glimmer of hope in these soberingly high figures is the fact that the rate of daily deaths seems to be slowing down slightly. So if you look at the figures from the start of April, from the 2nd of April, the number of deaths was doubling every 3 days. We now know it's doubling every 5 days. But like I say, to have a death figure of 917 in one day